Hi, welcome back to my channel. It's Saturday the 17th of May 2025 and it's about 9:45. Before I start, a message for Sandy. Sandy said last week she agreed I need a smaller size trousers. So I've left the label on to show you, Sandy. I'm actually wearing the size 10 today and I have to say you were right, these are a lot more comfortable. Thank you. Right, let's kick off with our usual what's for the basket. This week I have two things. I'm very much into pickles, I love pickles, and this week I've had an absolute craving to eat mussels. So on one day I had pickled mussels, on another day I had fresh mussels, and mussels are 12% protein, so they're actually quite filling. The other thing for the basket, besides my jar of pickled mussels, is a jar of chopped garlic in brine. And it's quite roughly chopped, isn't it, Joe? It's not...
Yeah, it's
like
more chopped than
crushed.
Minced, yeah.
Yeah, it's more chopped than minced. So it's ideal. I would throw bits of that on top of anything I was eating because I'm garlic mad. But you could use it in dishes when you were cooking as well. So that was from Lidl. That was from Sainsbury's. Okay. My word of affirmation this week is progress. And I think maybe that's what a lot of us would like to make. We'd like to make progress on our weight loss journey, or we'd like to make progress by actually kicking off a weight loss journey and having a fresh start. The topic I want to talk about this week is something I knew very little about until I researched it and got a bit more interested. And that is Mounjaro. And I'm going to say Mounjaro because Ozempic is something I relate to people who are diabetic. Now Mounjaro is probably similar, but the only people I know who have used Ozempic have been people who've had great difficulty getting their sugar levels down. It's not been about a weight loss thing. My experience of Mounjaro is very much based on what I've seen on YouTube and what I've researched myself, and I know that I could go on the internet today and I could buy Mounjaro. I'm not sure I could go on the internet today and buy Ozempic. I don't know enough about it to state that. But bear with me, because where I'm coming from is to say that at times I have been so desperate to lose weight that, honest to God, I would have jokingly had my mouth stapled shut. I had a lovely friend who once had her jaws wired, but it didn't work because you can liquidise Mars bars. Have you ever been that desperate that you would consider almost anything? Years ago I had a gastric band. I don't have it anymore. I've had it totally, like, you can't have it removed. I had it done privately. You can't have it removed, but you can have it emptied, so it doesn't have any impact or effect anymore. When I got into Slimming World, which was 5 years after I had my gastric band fitted, I realised I couldn't eat on Slimming World with a gastric band because I couldn't eat vegetables, I couldn't eat red meat, I couldn't eat fruit, but I could eat chocolate, I could eat ice cream, I could eat any kind of biscuit, any kind of cake. All of those things went straight through my gastric band. But if I wanted to do Slimming World and I wanted to eat rice and pasta and vegetables and fruit and chicken and all the things that Slimming World recommends we eat for a healthy diet, none of those would go through my gastric band. So I used to spend every day, all day, throwing up. My husband got a bit sick of that eventually. So I had my gastric band loosened. It was a tool I used to get me started, to help me to lose the first 6 to 7 stone on my journey. And then I went solo, and I joined Slimming World. I found a tribe of people who understood where I was coming from and who were trying to do a very similar thing to me, i.e. drop some weight. Now, with Mounjaro, I watch YouTube channels, and at first I found it quite scary. I'm thinking, so I could go on the internet and I could just put in these details. I don't need to go to my doctor. I just put in these details. I pay my 150 quid a month or whatever, and I can inject myself with this stuff, and I don't even really understand what it is, and no medical doctor needs to know I'm taking this because I don't have to go and get the approval of my GP. I don't think I would get the approval of my GP anyway, because my GP would say to me, you're losing this weight on Slimming World, you don't need it, you're not diabetic, you are obese but you're not morbidly obese anymore, what are you playing at? Our practice is not an easy practice. If I went to my practice and I was a type 2 diabetic and I was struggling with my blood sugar, I would be so grateful for the help, because it's the blood sugar that I see as the danger. You need that down to protect you. You need that down, and you need to keep it down, and it protects you against, it helps you with your cardiac health and all this sort of thing. There's so much more to that. So I've got an understanding of that, and I would support anybody who is in that position. But now I need to learn to support anybody who wants to make progress and use something like the GLP-1 drug Mounjaro, which is what I'm going to keep calling it. I know there are lots of other names, but I need to learn that within Slimming World there is a place for this drug that is going to happen whether we like it or not. And when I first heard about it and thought about it, my opinion was, I don't want that in Slimming World. I'll be honest with you, I don't want that in Slimming World. I want Slimming World to be about the plan that Margaret Miles Bramwell created to help people like her and you and me to lose weight and keep it off. But times are changing. And I think in America, the GLP-1 drugs have had a huge impact, and not a good one, on Weight Watchers, who are now declaring bankruptcy and clearing a lot of debt and having to change the way they see weight loss. Now, I don't want any of that to happen to Slimming World, and I don't think it will. But I do think that my mind has got to shift to accepting that there are people who need or want to use these GLP-1 drugs as a tool to weight loss. Now, the reason I want to discuss it today and my feelings around it are, if I was one of those people, I would be so grateful to know that there is support out there for me, and I don't need to do this on my own. I don't need to fly solo. I could come to the same place as the place I go to, or the place some of you go to, and I would be accepted and not judged, because it's a tool. Now, I've written 1 or 2 headings for Joe because I needed a couple of pointers to jog my memory. But there are so many things around this drug that I don't understand fully, but I want to, because I want to know that if I sit next to somebody in group who is openly using a Mounjaro, because I don't want to push anybody into a position where they've got to be secretive. We need to be loud and proud about our weight loss, whichever way we're doing it. So if I was to sit next to somebody who was openly using Mounjaro, I don't want to judge them. I don't want to do what I initially thought and think, that's cheating. Because I don't think today that it is. I think that today we have different needs. We are different people. But I want Slimming World to be the tool that people use to re-educate themselves in how to eat. So I'm going to ask Joe to quickly go down this list of points so I don't miss anything I wanted to say, because my memory is not what it used to be. Okay, Joe, let's take it from the top.
Okay, so the first one was Mounjaro or Slimming World?
Yeah, Mounjaro or Slimming World? Question mark. Answer, why not both? Yep.
Right, no quick fix.
There is no quick fix. Slimming World isn't a quick fix. Mounjaro isn't a quick fix. But hand in hand, they can be a long-term solution. The quick fixes in the diet world are what we used to refer to as liquid diets. So people would go and they'd get Cambridge, or they'd get Lipotrim, or they'd get whatever. And I dropped 9 stone once in 7 months. Jesus. Took me about 6 months to put it all back on again. That's what happens with quick fixes. Okay? So there are no quick fixes. It's a lifestyle, and it's a lifelong journey. If you want to lose weight and you want to keep it off and you want to live a different lifestyle, it's a day after day after day solution. Next.
Aftercare or doctor's support?
From my research of Mounjaro, because I know I could just go on the internet, fill in all my details and buy it. £150 a month, I think. I might not be totally right about that. I don't have to tell my doctor. I could lie about my figures. I could say, oh, today I weigh 13 stone and I want to be 10. Or today I weigh... There is a video out there by a young lady called Kath brackets Nails the Day. Now I've looked for it this morning and I can't find it. I've watched it once where she actually went onto one of these websites and she lied. She wasn't going to buy it, she was just testing it. She lied about the weight, she put in some ridiculously low weight, she wasn't an obese weight to start with, and they said yes, you can buy it. Now for anybody out there who's got body dysmorphia or a serious eating disorder and wants to get rid of that noise in their head, you know, the food noise, if they could go on there and buy this, isn't that dangerous? Anyway, next point, Joe.
Okay, done Slimming World before without Mounjaro.
If you've done Slimming World before without Mounjaro and you've struggled with that food noise and those cravings, do you think this could be the solution? Could this be the final tool in your arsenal that will get you over that line? That will support you, where your group can support you with the image therapy, but could this be the final tool that makes all the difference and supports you with getting rid of the food noise, getting rid of the cravings? I hear so many people speak about it on YouTube and they say those things. Now, I'm not going to say do it or don't do it. I'm not a doctor. I'm not advising anybody to take it. I would not take it. That's my personal opinion. I don't need to. I've got Slimming World and it works for me. But there are people who are not in the same place as me. Are you one of those people? Could we support you at Slimming World? You've got that tool in your arsenal, but could we be the tribe, the backup, the support, the image therapy that would retrain your eating and that might make all the difference? Next point, Joe.
Regain after Mounjaro.
This is something I've been researching in the last couple of days, and we've looked up even on things like ChatGPT this morning. What happens when you stop taking it? Exactly the same thing that happens when you stop doing Slimming World. I stopped doing Slimming World, didn't I, and regained 5 stone. Oh, 5 stone plus, I don't know, I can't remember exact figures. It says on the information we've looked up this morning that when you stop using Mounjaro, the chances are the weight will come back. Unless you've changed your eating habits and you've found a way of maintaining and sustaining that weight loss. And this is where I believe Slimming World could slot in nicely. Because if you do Slimming World properly, if you learn to eat in a way that can keep the weight off, and there are people out there who are vlogging for Slimming World who are doing exactly this. I had a comment from a lady called Stephanie 1975 who pointed out to me that, you know, she's at Target and she has been for a good while, and how she stays there. Now, if you re-educate yourself in that way and you keep doing what Stephanie's doing, you'll keep the weight off. But you won't if you just use the drug and then stop using the drug and revert to the old eating habits. That doesn't work for any of us. Next.
£150 a month.
Yeah, I know I've heard people quote the figure £150 a month. Now that sounds doable for some people. It's not doable for everybody. For some people that's an awful lot of money. I mean, I looked at it, I thought, God, that's £1,800 a year. It's £1,000 less than my council tax, but I still wouldn't want to have to pay it every year. If you seriously need it, if you've got the health issues that are aligned to needing it, if you're type 2 diabetic, don't buy it before you've been to your doctor and asked for a prescription. Because unless you believe you're worth it and you can go to your doctor and put forward a good case, you could be wasting a lot of money. You know, if your doctor thinks you need it for all those right health reasons, I believe they will prescribe it. I think a lot of it is a postcode lottery. I think it depends where you live. I mean, where we live, you can't get to see a doctor, so it won't make any odds. But don't just think, I'm going to do this secretly, I'm going to do this in private, I'm going to go on the internet, I'm going to find the money, I'm going to do this. Go to the doctor first. Be open and upfront about what you're doing. And can somebody explain to me something I've seen this week on YouTube, that you're supposed to inject this drug every 7 days. So you get this pen thing and it gives you I think it's got a 30-day lifespan, and you keep it in the fridge and you get 4 doses of whatever, 2.55, 7.5, 10, whatever stage you're at. Seems to me you can increase your dose when you feel like it. And I've noticed that people are re-injecting after 5 days. What's that about? If a doctor prescribes a dose of medication, and this is how you take it, this dose every day or every 7 days or whatever, who are we as non-medically trained individuals to suddenly come up with this brilliant idea? Oh, after 5 days this starts to come back, that starts to come back, I'll jab another load in. I need somebody to explain that to me, because I think that's insanity. Next one, Joe.
Well, you already spoke about this one, but who can buy it? And
yeah, who can buy it? It seems to me that it's open to anybody. And the thing that frightens me is people with severe eating disorders, people with severe weight problems that they don't even know whether they're diabetic or not. Because I watched a gentleman on YouTube the other day who has nothing to do with Mounjaro. He's just a lifestyle vlogger, a gardener, a allotment chap called Sean. And he came on and he knows bugger all basically about Mounjaro. I don't know a lot, but he knew less than me. And he's like, there's this magic drug and you just inject it for 3 months and it's the answer to losing weight. All you need to do is a bit more exercise. He never once mentioned all you need to do is change what you eat and maybe do a bit more exercise, but the food is much more important. And I'm thinking, hang on, there are people out there who are so desperate to lose weight that might think 3 months at £150 a month, I can afford that if I look into my savings and I don't do this and I don't have that, and and also, it's like, if you're a heavy smoker, should you be taking these sort of drugs? Do we know enough? Have you done your research? He's not a smoker, but I don't like the fact that somebody can just come on there and imply that for £450 you can lose all your weight and all your problems will go away. I don't even believe that with Slimming World, when I lose all my weight and I get back down to where I want to be, like when I was 8 stone 8 or whatever, my problems never went away. A lot of my food problems were dulled and numbed, but I still had to be on top of it every day. I worked the plan, I enjoyed it, and that's maybe why I kept working it back then. But none of my problems went away. Wherever I go, I take me with me, And if you're a person who suffers with anxiety, and if you're a person who suffers with obesity, and if you're a person who suffers with addictive behaviour like I am, those things do not stop. It's got to be a lifestyle change. So really, even if you can afford what Sean was implying was 450 quid to lose weight, it's not the best way to spend your money. But what I'm trying to say through all of this is I have had to change my thinking. Because initially I thought, I don't want these drugs in Slimming World. I don't want to be this side of the room is people on Mounjaro or that side of the room isn't. I don't think that would ever happen. I think that was my insane thinking. What I want to say today on my video is, I believe if you're taking the GLP-1 drugs in an effort to change your life, change your lifestyle, your eating, your weight, and you are responsibly doing this, I'd love to sit next to you in a Slimming World meeting. You would be welcome, I believe, in a Slimming World meeting. If you have any doubts about this, ring Slimming World head office, ring a local consultant, ask. Because we're here, I believe, to support anybody who wants to lose weight. I don't think Slimming World is a judgmental place. I think I saw it wrong at first. I think I was afraid that something could come in and take away what we'd got, the way people were wittering on about it changing Weight Watchers in America. But I would say, if you're taking a GLP-1 drug and you wanted to come to my group, I would be pleased to meet you. Okay. That's all just my opinion. I have no medical experience. I wouldn't tell anybody to take this drug, but likewise I wouldn't tell anybody not to. I don't need it. I'm fortunate. I've got what works for me in Slimming World. So what did I do this week at group? Well, you know the previous week when I said I lost 3 pounds and I hadn't done any walking or anything because I hadn't been well enough. Well, this week we went back to our usual sort of style of walking, and I think most days we were probably doing between 10,000 15,000 steps a day. Now I only put a watch thing on when I go for a walk. I don't keep it on all day. So when I say, oh, yesterday I did 14,900 and something, that was when I went out for a walk. That was my minimum. It's never my maximum because I can't bear to wear a watch all day long. But I feel better for getting back to walking. I feel better for getting out in the sunshine. Although it hasn't been hot every day this week. We went out one day and it was quite cold. But we've walked and at least 10,000 12,000 steps a day. I went to group on Tuesday, I got on the scales, I lost another 2 pounds. That's quite astounded me because in 3 weeks I've lost half a stone, which is way better or way higher loss than I usually have. I'm still eating to lose half a pound a week. I was thinking, one of my friends, he used to say, oh, I have a summer weight and I have a winter weight, but I never eat any differently really. I was thinking maybe, without thinking about it subconsciously, when the weather's warmer, we eat different. I'm not having as many hot cooked meals. My meals are much more cold, what do you call it, not grain-based, carb-based, salady type things with no lettuce, no tomatoes, no onions. I do have shredded cucumber. Joe shreds baby cucumbers. And I've eaten fish much more in the last couple of weeks. I haven't eaten any red meat, I don't think. I don't eat eggs more than probably 2 a month. So, but I do go high protein, so I will eat prawns. This week I've really craved mussels. Joe was saying to me yesterday, I think you should try sea bass, you'd love it. I may well try sea bass. I've got salmon in the freezer from Marks and Spencer's, but I cannot bring myself to eat it. I'm not a salmon girl, but in my head salmon means smoked salmon, and I know I don't like that. But I may try salmon this week. I'm going to stick with the fish. I'm going to stick with the plan 100%. I aim for up to 15 sims. I'm generally over 12.5, 13. That works for me. I don't want to be frightened of food in any way, shape or form. I don't do low carb. I don't need to. Everybody's different. You do you, I'll do me. If I tried to do low carb, I'd be starving. Yeah, and I'm thoroughly loving the plan. And when I go to group on Tuesday, I'll be on it for a year. So after a year, I'm going to report back how I've done it for a year, why I've done it for a year, what results I got in the year. So £2 off this week, really chuffed with that, really good group. And I think next week it's a taster for Man of the Year. I hate them. I cannot. If they can do them, it's a Slimming World thing, isn't it? But I cannot face all that, low-fat tiramisus, low-fat trifles, whatever, at 9:30 in the morning. That's not for me. But a lot of people in group love it, and there is a part to play and a place for it. It's just not for me. I would rather have image therapy anytime. But that's fine. So looking forward to group on Tuesday. Won't be eating the food on the table, but that's my choice because it's not the kind of food I eat. Have a good week, everybody. If you've got any thoughts or comments about GLP-1 drugs, share them with us. If you are using a GLP-1 drug and you want to, share it with us.
You're getting near 25.
Okay, it's just a tool. Cheers, see you next week.